Alright, so we've come to assess a 31-year-old female who has had a stumble and injured her ankle whilst out walking in the park today. All her vitals have been assessed and they're generally within acceptable ranges, except her heart rate's slightly elevated at about 92. She's got a GCS 15 and just complaining of pain to the lateral aspect of the right ankle. She did get up and walk a few steps over from the footpath over to where she's sitting right now in the park. So, Tina, is it alright if I just assess your ankle to decide what sort of injury you've got?
Yeah, that's fine.
I'm going to go through a little assessment to decide whether or not you need an x-ray on it, to decide whether it's a fracture or whether it's more likely just a sprain or something like that. So you told me before that you had actually stumbled and fallen over there, but you managed to walk with putting a bit of weight on it over here?
Yeah.
Yeah? Where was it painful?
It just seems to be painful around here.
Okay, alright. So if I touch anywhere along the bony surfaces, you tell me if it's tender. So as part of the Ottawa ankle assessment, for the ankle zone or the malleolar zone, we'll assess the distal portions of the medial and lateral malleolus, generally about the distal 5 to 6 centimetres for any bony tenderness on palpation. Is there any pain there when I touch that?
No, that seems to be okay.
No, that's good. And then for the midfoot zone, we're going to assess for any bony tenderness at the base of the fifth tarsal or at the navicular. Is there any pain there when I felt that?
Yeah, it just seems to be a bit painful there.
A little bit painful there?
Yeah.
Okay, alright. So she did manage to wait there, but she does say she's got some bony tenderness at the base of the fifth tarsal, which may indicate fracture, so maybe you might need to get an x-ray for that. Okay. Now we also need to assess any limb baseline changes. So assessing bilaterally for any unilateral differences, we'll assess for colour. They both look good. Sensation, does that feel normal on both feet?
Yeah.
Does it feel the same?
Yeah.
Yeah. Movement, can you wriggle both sets of toes for me? Is that painful when you do that? Are you able to move this ankle a little? Just okay. We'll assess capillary recall. Less than 2 seconds for both. And the warmth sensation. So colour, warmth sensation, capillary recall. And last thing we'll do is just check for a fetal pulse. Which there is one, and I'll just make a mark there with a pen. Alright Tina, so the recommendation based on that assessment is that we should get you an x-ray. Alright, it's good that you were able to weight bear on it, but just because you've got that bony tenderness there, we really should have an x-ray just to make sure there's not a fracture in there.
Yeah, okay.
Okay. You also mentioned that just before you had the stumble you felt slightly lightheaded.
Yeah, just a bit dizzy.
Yeah. Is that normal for you?
No, but I have been feeling a little bit dizzy intermittently over the last couple of weeks.
Okay. Have you got any history of heart problems or diabetes?
No, not that I know of, but I do have a family history of diabetes.
Okay. And have you been tested for diabetes before?
No.
No? Okay. Have you felt like you've had any increased thirst lately? You need to drink extra water?
Yeah, come to think that I have been quite thirsty lately.
Yep. Okay. And have you been urinating more than normal?
And yeah, I guess so, yeah.
Okay. Alright. Has it been darker in colour or showing obvious dehydration?
It has been darker and it has been smelling quite strong.
Yeah. Okay. Alright. And have you noticed any problems?
No.
No. Any other problems? Have you had any sores or ulcers or anything on your feet or anything that haven't been healing well?
No.
No? Okay. And any other problems with your tummy, feeling nauseated, diarrhea? So based on those answers to those questions that Tina's given me, we'd have to suspect she might need some further investigation for diabetes. So we've just gone through a perfunctory endocrine assessment. So I'd also recommend that if not at the hospital, she certainly sees her GP to assess whether she's got any issues with diabetes. Following on from that, we'd do probably a brief CNS assessment to make sure everything's all right there. But otherwise, really just an isolated ankle injury. And the last thing we'll do is just assess her blood glucose level, which will help in the demonstration as well. So are you happy that we transport you through to the hospital and get you checked out here?
Yeah, that would be great, thanks.
Alright. Okay, so this is a demonstration, a very quick demonstration on blood glucose measurement from the capillaries. So the first thing is to ensure that everything's clean and tidy, aseptic, and get the patient to wash their hands as best as you can. So we insert the testing strip into the glucometer, select a finger, and it's best, especially with diabetics, to use the side of the finger as opposed to the pad. Because of circulatory issues, they can develop nerve damage on the end of their fingers a lot faster if we start using the end of their fingers with the lancet. So if you tamp out the finger a little bit, tell the patient a quick jab coming up. Take a dot of blood, doesn't have to be much. And put a little band-aid on the end of their finger. And you wait for the countdown. And 7.9 millimoles, so normal range is anywhere from 4 to 8.